This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us today. As I'm sure you've heard, COVID cases are surging in Ohio. We've hit record days just about every day in the past week. So here's Governor DeWine talking about our record-breaking COVID cases, and his guest today during his press conference is Dr. Rick Lofgren from the Cincinnati area.
We are reporting 3,590 new cases today. This is by far the highest number of cases we have ever seen during the entire pandemic. In fact, it's about 700 cases more than our previous high, which was just a few days ago. The virus is raging throughout the state of Ohio. There's no place to hide. We now only have 2 counties that are yellow, and they represent only 1/5 of 1% of our state's total population. So every county is red or orange. Only 5 of our counties are not high incident counties. So 83 of our 88 counties are high incident counties. Since there is no place to hide, all of us together have to come together to fight this enemy. We have to come together to fight this invader. We have tools to beat this virus back, and we've learned a lot during the pandemic. The tools are very simple. It is more people wearing masks, more people keeping distance, washing our hands, good ventilation when we're inside. We got to get back to fundamentals. We got to get back to the basics. I'm today calling on the leaders of each county, each community throughout the state of Ohio to come together to create a COVID defense team. This COVID defense team that we are asking every community to form is really what we need to fight back. It should certainly include the county commissioners, mayors, local hospital leaders, certainly the health commissioner, business leaders, religious leaders, and other local leaders. It should be in each county representative of the community. I'm asking the COVID defense team in each of our counties to assess and understand their situation, to inventory their assets in the community, and to focus on what steps to take to turn the situation in their community around. Because we now know what works to fight the virus, a major part of their job will be to explain to people in the community exactly what is going on in the community, the state of the virus, what's going on in their local hospitals, and what steps must be taken to slow this advance of the virus. And my team in the last 3 days and I have been doing hour Zoom calls, starting with the counties that were high incidence counties, and now we've moved to the counties that are the highest number of cases in the last 2 weeks. We will continue to work down that list. I think that these calls, from my perspective, have been extremely productive. Each county has committed to expanding their working group to include more people. They have each committed to meet at least once a week. And they have each one a specific goal, reducing the active new cases that are coming in each day. And I just want to say I've been so very, very impressed by the leadership in these counties. So far, we have met with the leaders, some of the leaders in Clark County, Cuyahoga County, Hamilton County, Mercer, Allen, Putnam, Auglaize, and this morning, Holmes County. We will start again tomorrow morning with more counties. But we ask the counties not to wait for us, not to wait for us to schedule the call. It will take a few days, of course, for us to get through all 88 counties. But we ask people to go ahead, schedule your own meeting, put your own local leaders together. As one of the leaders said to me yesterday, if a tornado hit our county, and he said it has hit our county, he said everybody rally together. We came out to help friends. We came out even if we didn't know the people. That's what we're asking communities to do again. Ohioans are great about this. I remember a few years ago, a lot of floods along the Ohio River. I was just so impressed that how many people came out to help their neighbors. Same way when tornadoes hit, people come out. This is a crisis that is grave, certainly, and much more widespread than those crises. So despite the grim data that we see today, that we'll show you in a moment, I'm optimistic because Ohioans have the tools. We know what works. We always rally when we need to rally, and I'm confident that people will do that. When people see a threat, particularly to their families, to their neighbors, to their community, they come together. We can, in fact, slow down this invader. The decisions each Ohioans make each day will really determine what kind of winter that we have. We must mask more. We must distance more. We must be more careful. We must wash our hands more. We must have more ventilation inside, particularly as we move more inside as winter approaches. We can control our own destiny. Eric, let's look at the numbers. As you will see, today we have, as I said, set another record. We report 3,590 cases. This is the first time we've surpassed 3,000 daily cases per day. To put that in perspective, today's new cases, our figure is about 25% higher than the second highest date, which we reported just last Saturday. It's not only the case numbers, though, that are increasing. We also have 192 new hospitalizations reported in the past 24 hours. This is the third highest we have ever reported. The top 5 highest new hospitalization numbers have all occurred in the past week and a half, so we continue to be very high. I spoke with Hamilton County leaders yesterday, and on that Zoom conference meeting, we heard from Dr. Rick Lofgren about what they're seeing in the hospitals in the region. Dr. Lofgren has been on here before. He's a zone lead for the Southwestern Ohio region of our pandemic response team. He's president and CEO of UC Health, the University of Cincinnati's affiliated healthcare system. He also is an internal medicine physician who has also worked in Kentucky, Wisconsin, Pennsylvania, Minnesota, and Michigan during the span of his career. Doctor, thank you very much for being with us again. Appreciate it.
Thank you, Governor, and I appreciate having an opportunity to speak. You know, as you mentioned, we have seen a decisive increase in the number of COVID-19 cases and an increase in hospitalization in our region. You know, we did a great job as Ohioans suppressing the spread of this virus through the summer and into the early part of the fall. We were opening up our activities and our like. And really what we were seeing at that time is really the opportunity or the seen across our community sort of hotspots. It was a facility or an area, a specific group that we were seeing some cases, and we were able to get resources around that and actually bring it down. However, in the last 3 weeks, as you mentioned, we've seen a rapid increase in the number of cases and hospitalizations. That's been nearly doubling every 2 weeks. To the hospitalization at a level like we've never seen before. And I think that one of the things that's really notable, I think, is that unlike what we saw before, this spread is diffuse. There's no one particular area, no one particular group or facility that really accounts for the increased number of cases. I might also say that we used to see much more in the highly dense urban core. That's not the case anymore. We see it up in the suburbs and in the entire area. And as you mentioned before, we're also seeing an increase in our positivity rate in all the different age groups. Not that many weeks ago, our positivity rate in Hamilton County and in the various age groups was right around 3%. But right now, we are seeing positivity rates in every one of our age groups somewhere between 5 and 6.5%, all of which has really happened in the last 3 weeks. As you mentioned, I think our businesses have really done a nice job of adhering to safety guidelines and keeping the work environment safe. And our schools have done, I think, a remarkable job, as you said before, is that they really have had really remarkably few positive cases as we adhere to those standards that we know work. We know what keeps this virus at bay. It's there. If you let your guard down, it spreads. And so it really appears that the vast majority of the spread is really occurring in private social events. I think we're simply letting our guard down. We all have COVID fatigue. But we know it works, and I think we're starting to see people expanding their bubble. You need to ensure that there's a small cadre of people who you live with, but we all are social animals. We want to increase our bubble, and I think people are sort of letting their guard down. And in some respects, sort of believe that, well, if I know you and you're a friend of mine, I can let you in my bubble and you're really not at risk. Where in fact, we need to recognize that if we expand our bubble, you're increasing your risk. At any given point in time, we don't know who amongst us may be actually infected without symptoms and inadvertently spreading the virus. And so that we need to go recognize, particularly as we start to go indoors, because before we could do some of these social events outside, that we really need to maintain those steps that we know that work when you're going to increase your bubble. Having somebody into your home, you need to maintain the social distancing, and you need to wear a mask. You need to recognize that anybody who's new into your environment may potentially be infected. I think this is going to be a particular challenge as we start to think about the holidays. We're all going to be delighted to see some relatives and friends that we haven't seen before, but we need to understand the way in which we celebrate has to change, in that if you're going to bring people into your environment, you have to maintain social distancing. You have to maintain the masking and all those things that we know that work and are effective as we move forward. So sometimes I get asked about testing before events, and it's certainly nice to know whether or not you are negative before an event, but it's also not a reassurance. I could be tested today and be negative and then be percolating the virus within me, go into somebody's bubble and inadvertently spread the virus. So I think the message to our community and to each other and to Ohio is that we've learned a lot in the last 6 months. We've learned what's effective in terms of keeping the virus under control. We really have seen our organizations and our community responding, and the businesses and the things that they're doing in the schools. And as you mentioned, the football story, it's not the formal events where we take these measures where we're seeing the spread. It's the informal events that happen that we really start to let our guard down. So I think one of the messages that I think is important as we see this marked uptick throughout our community is that we really need to recommit and understand that we need to maintain our exposure and our bubble. We have a small cadre of nuclear people that we live with, and we realize that anybody else who comes into it, we just need to treat them like even a stranger. Keep your distance, wear your mask, wash your hands, and sanitize your environments.
Doctor, thank you very much. We appreciate all you're doing, and thanks for that summation of where we are today. Thank you very much.
You bet.
Appreciate it. It goes without saying that the pandemic has changed all of our daily routines, but for our children with developmental disabilities, these changes can be extremely disruptive to their learning and to their development. Many children can struggle with remote learning, but children with IEPs are often also losing needed in-person support, such as individualized instruction, behavioral support, occupational therapy. To assist children and families with IEPs who are doing remote learning, we are launching Learning Aid Ohio, a supplemental tutoring program. Starting on Monday, eligible families can apply for up to $1,500 in grant funding to cover costs of tutoring and other needed supports. To apply for a grant or to sign up as a provider, visit learningohio.com, learningohio.com. We're ready for questions.
Governor, first question today is from Laura Hancock at cleveland.com.
Hi, Governor.
Hi, Laura.
Hi. My question is, you've pointed out some anecdotal data about like the football teams, informal parties, but how can you say that this ongoing surge stems from private informal gatherings among family and friends, the actual types of events where contact tracing is easier than other places such as bars, when you have no empirical data to back that up? Have you made any kind of renewed effort to find out, other than just tweaking last week from the contact tracing system?
Yeah, I mean, we're trying to get better data. The old system was not designed. The system is not designed to drill down in a pandemic to find out where the spread is. So I think we explained last week exactly, what we have. We have anecdotal notes that are coming in from tracers. And so we're going to try to bring about some consistency. But even then, let's say someone has got the virus, you're on the phone with them, the tracer's on the phone with them, and they say, I was in a bar one night, I was in a restaurant the next night, I was at work today, I was here. So all that person would write down is all those different things, and you still are not going to know where they got it. So, unless it's a big super spreader event, many times it is impossible to know for sure. But what we rely on is some of this, what we're hearing from the health directors. They're the ones that are out there, 113 different organizations out there. They're the ones who are monitoring it and watching it every day. This is what they tell me, because I'm not out there. I'm not making the calls. Dr. Lofgren, what he just said, which was the same thing, and other doctors are telling us that as well. Doctors who are treating COVID patients are telling us this is where we are seeing the spread. This is what they're telling me. So we're never going to, please don't misunderstand what I'm saying. I'm not saying there's not spread in workplace. I'm not saying there's not spread in schools. I'm not saying there's not spread in bars. But what I am saying is a big component part of this, according to everybody who is dealing with it every single day, the frontline people, they are describing these informal get-togethers and these informal events. And the big spreader, the big spreader ones, funerals, weddings, big get-togethers, that's what we're seeing. So all I'm trying to do for the people of Ohio is report what we're hearing as we talk to the people who are on the front line.
And Governor DeWine on the pandemic and the surging numbers here in Ohio. I'm Mark News. Thanks so much for joining us.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
This is House Call for Health. You should now get screened for colon cancer earlier than previously recommended. A panel of national experts in disease prevention has a new draft guideline for the third leading cause of cancer deaths, starting at the age of 45 instead of 50.
The big takeaway is that we're recommending that all adults age 45 to 75 get screened for colon cancer. We know that screening saves lives, and that if people get screened, we'll prevent people from dying from colon cancer.
Dr. Alex Christ is the U.S. Preventive Services task force chairman.
Basically, a 45-year-old today has the same risk of getting colon cancer as a 50-year-old from years past.
Other organizations have previously recommended a younger screening age. In 2018, the American Cancer Society changed its guideline from 50 to 45. Black Panther actor Chadwick Boseman died from stage 4 colon cancer at the age of 43 in August. For more health news, go to foxnewshealth.com. House Call for Health. I'm Lisa Brady, Fox News.